Hi guys, welcome to our channel. We asked you guys what questions you had about Invisalign and we got a lot of responses. So today I got the amazing Dr. Nicola Gore with us here today to answer all the questions for you. So the first question we had was, how does it work?
Invisalign is a series of clear aligners. They're worn minimum 22 hours a day. The material is actually a smart track material, engineered in such a way that it moves the teeth with precision and predictability. It is a flexible material and is clear, so it doesn't show. Normally, patients get between 14 to 26 weeks of aligners, and depending on what system is suited for the patient, the aligners are changed once a week or once every 2 weeks.
The next one is a common one that we got. We had quite a few people asking this, does it hurt?
So again, another good question. The first day when you change your aligner, it could hurt because obviously it might be a bit tighter and you might experience a little bit of discomfort. But by day 2 of your aligner time, then you should find more comfort in it. So you'll soon adapt and the pain will go away. You can take painkillers like paracetamol or Nurofen, and that should help.
So the next question is, how long do I have to wear them for?
Minimum 22 hours a day. You have to remember, if you did have fixed braces, they'll be on your teeth all the time, so they'll be moving your teeth all the time. So Invisalign is actually doing the same thing, but if you don't wear them minimum 22 hours a day, you're not going to see any result.
And when would you take them out?
Only to eat and to clean your teeth, and that's it.
So the next question we have is, how often do I need to come to the dentist to have them checked?
Okay, so depending on what type of Invisalign you're going to use, every 4 to 8 weeks would be the common gap between coming to the dentist and having your teeth checked, having the attachments checked for the Invisalign, having your oral hygiene checked, and be given new aligners to take home.
Okay, so the next question, what are the differences between Invisalign and normal braces?
Okay, and that's a very good question. So normal braces are fixed to your teeth, and an orthodontist would do that for you. Invisalign are clear aligners, which are not actually fixed to your teeth, and they're removable, so you can remove them to eat and you clean your teeth. So there are two different ways of moving teeth.
So we had a lot of people ask this one, and everyone wants to know, how much does it cost?
Again, a very good question. As you know, prices vary from area to area, from practice to practice. In my practice, I have made a nice comprehensive package for my patients, so that I include all the retainers, because it's quite important to have retainers after your treatment is finished, because otherwise your teeth will move. So I've included fixed and removable retainers, as well as teeth whitening, which everybody likes to do, and together with teeth cleaning, because it's quite important to have teeth cleaned while you're having your Invisalign. So the package itself is at the moment 3,500, and I'm happy to throw in more whitening gel for anybody who would like to come and have Invisalign with us at Totteridge Dental Studio.
So the next question we had was, can it go wrong or not work?
Okay, so again, that's a really good question. It can only go wrong if the patients don't stick to the correct protocol. Okay, and by that I mean Invisalign is something which is totally dependent on your commitment. So if you don't wear them the correct number of hours you need to wear them, if you lose them or break them, or you don't maintain a good oral hygiene and you don't track well with your clean check video, then yes, it can go wrong and you will not achieve the predictable smile that you want to achieve.
So next one is, what happens if I'm not happy with the results?
So if you're not happy with the results, and if it doesn't match the predictable clean check video which we have made of your teeth, then we can always request further aligners from Invisalign with no extra cost to you. All we'll have to do is rescan your teeth again or retake the impressions, and we can actually then construct further aligners for you to carry on to get to the stage we want you to be and you want to be.
So another question we had was, I have an implant and a bridge, can I get Invisalign?
Wow, that's a really good question, actually, though. You can, of course, you can. The only thing is that, of course, an implant and a bridge will not move. Okay, so we'll have to take that out of our equation when we're doing your Invisalign assessment. So we will be able to move your other teeth, but we will not be able to move your implant or your bridge.
So next question we had was, are there any risks?
So of course, with any treatment there is risks involved, but the risks are calculated risks. So by that I mean that the dentist you will be seeing, so if you came to my practice and you saw me, I will be doing a very thorough assessment on your teeth and your gums to make sure that you have no dental decay, to make sure you have no gum disease, to make sure there's no too much recession on your teeth. And the reason I will be doing that is that because if you've got poor oral hygiene to start off with and you've got gum disease, then the risk would be that you will maybe get very mobile teeth and your teeth might get loose, because the process of moving teeth is to resorb the bone. And if your teeth are already at risk of having gum problems, then this is just going to multiply.
So next one is, how old do I have to be to get Invisalign?
Okay, so Invisalign has different types of systems. So we've got Invisalign Lite, Invisalign Teen, Invisalign Go, Invisalign Go Plus, and Invisalign Comprehensive. So any teenager could have Invisalign. However, we find that with teenagers it's a little bit difficult because the commitment is a bit more difficult. It's a bit more challenging to get them to keep the Invisalign on, to not to lose them, not to put them in their sports kits and throw them away. So I have treated a few teenagers with Invisalign, but both me and the parents found it quite challenging in terms of keeping up with wearing them.
Yeah. So if you guys are up for it, then maybe consider it, but if you're not, then just wait till you're a bit older.
Yeah. Or fixed braces.
Yeah.
Yeah.
So another question we had was, how do I know if I can have Invisalign?
Okay, so Invisalign is suited better for people who've got mild to moderate crowding. So if you've got mild to moderate crowding and your teeth are not overcrowded and overcomplicated, then of course you'll be suitable. Your dentist will actually do a quick assessment of your teeth, of your gums, your oral hygiene, take some photos, and will be able to tell you whether you are suitable or not.
And once they're suitable, what happens next?
So after that, the dentist will have to take a series of x-rays of your teeth and records of your teeth in terms of taking impressions of your teeth or scans of the teeth, and we will then submit that to Invisalign. Invisalign will make you a clean check video. On the video, it will show you your predictable smile and how your Invisalign journey would be.
And I guess that's what motivates most patients.
Exactly. And then once you've seen your Invisalign journey and you see how long it takes and what the outcome is, you usually will commit to it, because it actually most of the time comes out really nice.
If you made it this far in the video, thank you so much for watching. We hope you found that video helpful. If you did, we'd really appreciate it if you guys gave us a like and subscribe. You might also enjoy some of the other videos that we have on the channel, so feel free to check out some of the suggestions we have here.